ensure through use of technology, all these initiatives can be integrated and technology available globally across the world. We have had around 180 participants participating from 19 remaining G20 member states, including we as in 10 invited countries and 22 international organizations which are working in health. This again, just to submit to you, we'll have a main event. We'll also have a side event which is focused on R&D network on medical countermeasures, which will again be discussing those frameworks. What should be done? What type of network should be created so that globally, across the world, there is promotion of availability of R&D networks that available. We also is going to have a co-branded event on global vaccine collaborative. I mentioned about the collaboration between health and finance in terms of ensuring we are able to take right decision at the right time will be also focused. This event will be happening in Novotel Hyderabad Convention Center, and as well as we are also going to take our colleagues from these G20 countries to Genome Valley, a pride for us, where you are all aware that who is who of the global sciences. So who is who of the global sciences companies exist in that area. మనకి ఇది ఒక మంచి అవకాశం. మన తెలంగాణలో చేసిన ఈ ప్రభుత్వం చేసిన ఈ ఎఫర్ట్ ద్వారా ఏ విధంగా టుడే 33% ఆఫ్ ద వరల్డ్స్ గ్లోబల్ వ్యాక్సిన్ ప్రొడక్షన్ ఈ జీనోమ్ ఉంది. అది మనం వచ్చిన వాళ్ళందరికీ చూపించగలుగుతాము. మనకి నాట్ ఓన్లీ వ్యాక్సిన్, మనకి పోలియో, రోటా వైరస్ వ్యాక్సిన్ అన్నీ అక్కడ తయారవుతున్నాయి. దీని ద్వారా మనం డెలిగేట్స్కి వరల్డ్కి చూపిస్తాము. తెలంగాణ రాష్ట్రం మన ఇండియా ప్రభుత్వం ద్వారా చేసిన ప్రయత్నంతో ఏ విధంగా మొత్తం ప్రపంచంకి మనం హెల్ప్ చేస్తున్నాము. సో దిస్ విల్ ఆల్సో బి షోకేస్ ఆఫ్ ఆల్ ఆర్ అవేర్ దట్ వరల్డ్ వైడ్ ఇండియా ఇస్ నోన్ యాజ్ ద ఫార్మసీ ఆఫ్ ద వరల్డ్. సో ఏ విధంగా దిస్ పొజిషనింగ్ ఇస్ వెరీ క్రిటికల్. వీ వాంట్ వరల్డ్ టు అండర్స్టాండ్ వేర్ ఇండియా హ్యాస్ రీచ్డ్ అండ్ హౌ ఇండియా ఇస్ గోయింగ్ టు సపోర్ట్ గ్లోబలీ in terms of making an impact in health. So this again is part of our health working group meeting. This is also an showcase our culture. Kuchipudi fusion dance ankochu, Maheshwar Mardini ankochu, Sufi Qawwali or any other Indo country. We plan to take the delegates to Golconda Fort. We plan to take them to Shilpa Village and also to Falaknuma Palace to show the rich culture. So dear, I would like to specifically highlight, idea is to show that this is a country with a rich culture and this is a country which is forward looking. So how does India, with that history to modernity, where that passage of India, the trajectory of India is what I like to showcase and collectively like to work with them in terms of making an impact in health. I would like to in that only specifically highlight that we strongly believe media has a very critical role in building public opinion. There are multiple challenges. COVID-19 has brought the importance of health to the fore. And we would like to take your help in terms of identifying those challenges, in terms of proposing those solutions collectively, not only at national level, but also at level. We're also looking through your support, ensuring that priorities in health working group and their proposed deliverables are made available to people. They are distributed to the wider set of audience and consensus is built. Everyone has to. These are not small challenges. These are not small tasks. Creating a global institution sometimes takes years. What, based on the guidance given by Honorable Minister, be ambitious, be decisive, be action oriented, are to ensure how do we create a framework globally that India's success story, India's learnings can contribute to global health is what we are trying to focus on that. We would like to also highlight India's successes in health sector and India's diverse culture and traditions. So with this, I had taken a long time, I know, but I wanted to submit to you that besides the priorities, India in its G20 presidency has been very ambitious in terms of putting issues across globally and ensuring that agendas need to be prioritized so as to make an impact. we need to deliver. We are working with global fraternity today to ensure that in health emergency happen, do we behave in an ad hoc manner the way we had rather forced during the ongoing COVID-19 pandemic, or do we create a framework where the global community is ready to face any challenge? As they always say, the question is pandemic will happen. The question is when it may happen, are we prepared? What India from its side would like to contribute through G20 in the globe. Thank you very much.
Thank you very much, sir. Thanks for the wonderful presentation. India's priorities in the G20 scenario, as well as India stands in the health sector in the world's perspective. Thank you very much. Invite media persons to ask any questions. Yeah, please. Yeah, please.
मैं नितेंद्र डीडी न्यूज़ दिल्ली से हूँ सर। आप कि समानता हो वैक्सीन या फिर जो डायग्नोस्टिक किट हो या फिर मेडिसिन को मिले, इक्वल मिले, जो लो मिडिल कंट्री है उनको मिले, लेकिन दौरान देखा गया कि कुछ कंट्री ने होर्डिंग किया और बाकी देशों को नहीं मिल पाया। तो भारत G20 की मीटिंग में कैसे एक सहमति बनाने पर इस पर काम करेगा और क्या रोल और किस तरीके से एक आर्किटेक्चर बनेगा?
नितिन जी, जैसे आपने बिल्कुल सही कहा, उसी को ध्यान में ये प्रायोरिटी हम लेके आए हैं। हम सब ने देखा है कि में रिसर्च एंड डेवलपमेंट नेटवर्क्स एग्जिस्ट करते हैं, कुछ देशों में मैन्युफैक्चरिंग एग्जिस्ट, कुछ देशों में नहीं थी। कोविड के समय में जिन देशों की इकोनॉमिक आदत है, उन्होंने अपनी पॉपुलेशन से भी अधिक संख्या में वैक्सीन डोजेस को बुक किया, तो जिस कम है उन्हें वह नहीं मिलेगी। इस असमानता को समझते हुए ही हम G20 का जो एक मेजर एक्शन है वो ये है कि कैसे हम इंश्योर करें कि राइट एजेंडा लाया जाए और उस पर एक कंसेंसस बिल्ड की जाए। तो हमने उसको 7 बकेट में डिवाइड किया है। मैंने आपको एक्सप्लेन किया। हम ये कह रहे हैं कि सबसे पहले वैक्सीन्स वर्ल्ड वाइड R&D नेटवर्क्स बने। हम उन नेटवर्क्स के ये कहना चाहते हैं कि ऐसा हो कि एक मेंटर कंट्री बहुत सारी और कंट्रीज को मेंटर करे, वहां पर भी उसकी रिसर्च एंड डेवलपमेंट की प्राउएस, उसकी स्ट्रेंथ आए। इसी दूसरी बकेट में हम कह रहे हैं ड्रग्स थेरेप्यूटिक्स के R&D सेंटर को प्रमोट किया जाए। यानी कि अगर हम ये कहें कि आज R&D विश्व के कुछ प्रांतों में, कुछ एरियाज में लिमिटेड है, उनके द्वारा हम आसपास की कंट्री और आसपास की रीजन को भी इंक्लूड कर वहां पर R&D को, वहां पर ड्रग्स की R&D को और वहां पर डायग्नोस्टिक्स की R&D को प्रमोट करें। जब R&D का प्रमोशन आप करेंगे तब आपके पास वह टेक्निकल टूल अवेलेबल के थ्रू आप उसको मैन्युफैक्चर करना चाहेंगे, क्योंकि आपके पास पहले एक वैक्सीन होनी है, ड्रग दवाई होनी है। उसके बाद हम कहते हैं कि मैन्युफैक्चरिंग नेटवर्क्स बने ग्लोबली। मैन्युफैक्चरिंग नेटवर्क्स वैक्सीन्स के, डायग्नोस्टिक्स के और थेरेप्यूटिक्स के बनेंगे। बकेट में आप इसको एग्जामिन कर सकते हैं। इसके बाद भी जैसे कि देखा गया, रिसोर्सेज जिनके पास ज्यादा है वह उसको ज्यादा गार्नर कर सकते हैं, जिनके पास कम है वह कम करेंगे। तो उसके लिए हम कहते हैं कि ऑन द टॉप ऑफ इट एक ग्लोबल मेडिकल काउंटर मेजर्स कोऑर्डिनेशन प्लेटफॉर्म हो। तो इन 7 प्रावधानों के थ्रू हम कहते हैं कि एक पूरा इकोसिस्टम बनेगा विश्व में, जिसके द्वारा कभी भी अगर कोई नेक्स्ट हेल्थ इमरजेंसी आती है तो ग्लोबली वी थिंक वी आर बेटर प्रिपेयर्ड।
Anyone?
So you are talking about the global networks, right? You are talking about finance and health. But if you really look into these frameworks, it falls under WTO framework and also intellectual property rights. And some of the G members whom we are talking about, I don't want to name it. Traditionally, right from after Second World War, these people are habituated to say, you can talk it loot or you can talk it theft from traditional medicinal practices of other countries. It may be Africa, Asia. They used to develop intellectual properties on that. So the first question is how you are going to transcend those domestic laws as well as WTO framework. Second one is, say we, particularly you are talking about when you are climatic impact on the health, you are also talking about spilling over genetic. So there may be a particular medicinal herb you are taking from some African country. So is it not possible that the property rights, or at least on the resources, should go to the people of the So these are the things, on the one hand, we are talking about big. On the other hand, these countries specifically we know, there is a practice in WTO as well as intellectual properties, because these entities which you are collaborating are legal persons in their country. They have protection for their corporate laws. So unless you cross over that, I think that these network and the things.
किस मीडिया को रिप्रेजेंट कर रहे हैं?
Hans India, sir.
Hans India, okay, good. So thanks a lot for raising a very important question. When I made a very specific point that these are contentious issues. These are issues on which take place over decades, and at times decisions are not taken. That is where the focus of India's G20 presidency is to bring that sense of urgency in decision making. When I mentioned to you that when we had discussed in our 2 health working group meetings with all the countries as well as the international organization, we got in principle agreement. Discussing with them that I use this saying generally even in my meetings that best is the enemy of good. I cannot do best, I will not do good, which means. Second aspect we also highlight to them is that yes, we work together, and when we are working together, there is going to be a lowest common denominator of together to begin with. There are challenges which have happened in global arena. Those challenges, bring them on table, identify those challenges and ensure that a minimum of action takes place. Second aspect we have very specifically highlighted to them is, be it intellectual property, it is always, there will be some people who will be talking about the intellectual property. There are also a set of people who talk about voluntary licensing, who also talk about public goods. So can we not promote them? Converge those initiatives globally and ensure that right things happen. Let me give an example. When we discuss in G20 again on digital health, we told them yes, there would be intellectual property proposed technology solutions. But there are certain people who are talking about digital public goods. We will give our Sanjeevani to world. Why should they be real? We did an analysis. Every country is making telemedicine. Every international organization spending money on telemedicine solution. Intervention will be costing $1 million. How many $1 million are doing reinvention? And if we can make our telemedicine solution as a digital public good, whole world free of cost, then they would focus on implementation. How do you bring global advocacy on ensuring that the focus should shift on action? Focus should shift on convergence in terms of working together, whether collaboration on intellectual property is what is our main focus. And that is where we're saying create a minimum viable product of collaborative efforts on medical countermeasures, which would also work with you to evolve working together on intellectual property, working together on sample sharing, working together on other aspects of making an intervention.
Including standardization of the alternative medicinal practice.
Exactly. So that is where, and about climate and health, I am happy to submit to you that when we discuss the topic of climate and health, and also on AMR and the concept of One Health, got a very positive response from all G20 countries. Because these are issues because of COVID has started understanding differently. We had been very specific that if we do not work together in terms of creating health architecture, our response or any delay in response has an impact impacting additional lives being lost. How do we work together? How do we ensure a framework where decision making happens fast? And I'm telling you, because one very positive thing which has happened is because of COVID-19 challenges, World is understanding those ideas differently now. And that's where we utilize India's G20 presidency to be better prepared for future. తెలుగులో అడగొచ్చు.
మిత్రులు తెలుగులో కూడా ప్రశ్నలు అడగవచ్చు సార్, అర్థం చేసుకుంటారు.
సార్ రీసెంట్గా మన
ప్లీజ్ ఇంట్రడ్యూస్ ఎవరు?
మల్లిక్ ఫ్రమ్ ఈటీవీ. అయితే రీసెంట్గా మన హెల్త్ వాళ్ళు కోవిడ్ కంటే ప్రమాదకరమైన మరో మహమ్మారి రాబోతుంది అన్నారు. అదేంటి సార్? అది
అంటే వాళ్ళు
ఎఫెక్ట్ ఉంటుందా?
వాళ్ళు ఒక నిమిషం అండి. థ్యాంక్ యూ. సో మహమ్మారి కోవిడ్తో కూడా పైన ఎక్కువ ఏదైనా మహమ్మారి రావచ్చు అంటున్నారు. అంటే ఇట్ ఈస్ నాట్ టు సే దట్ ఎక్స్ ఆర్ వై మహమ్మారి వచ్చింది. వాట్ దే సేయింగ్ ఈస్ దట్ వరల్డ్ అండర్స్టాండింగ్ దట్ దీస్ టైప్ ఆఫ్ డిజీజెస్ విల్ హ్యాపన్, దీస్ టైప్ ఆఫ్ హెల్త్ ఎమర్జెన్సీస్ విల్ టేక్ ప్లేస్. మధ్యలో మనకి మంకీ పాక్స్ ఒక ప్రమాదం కింద వచ్చింది. అంటే ఎంతకుముందు లిమిటెడ్ దేశాల్లో ఆ విధంగా కేసెస్ చూడటం జరిగినాయి. బట్ లాస్ట్ 1 year 70 కంట్రీస్ ప్లస్లో మళ్ళీ చాలా పెద్ద ఎత్తున స్ప్రెడ్ అయింది. సో దట్ ప్రమాదం మనకి అదేవిధంగా ఇబోలా అనుకోవచ్చు, జీకా అనుకోవచ్చు, నిపా అనుకోవచ్చు, మళ్ళీ వైరసెస్ అనుకోవచ్చు. దోస్ ఛాలెంజెస్ ఎగ్జిస్ట్ ఇన్ ఫ్రంట్ ఆఫ్ అస్. సో WHO తరఫున అంటే ప్లీజ్ డూ నాట్ లెట్ యువర్ గార్డ్ డౌన్. ప్లీజ్ ఎన్ష్యూర్ దట్ వీఆర్ బెటర్ ప్రిపేర్ టు మేనేజ్ ఎమర్జెన్సీస్.
Hello.
My name is Falgunachari from Eenadu. Sir, here are what are the priorities of COVID? And next question, నేషనల్ హెల్త్ మిషన్ యొక్క ఇనిషియేటివ్స్ అంటే కొత్తగా ఏమైనా ఉన్నాయా?
సో ఒకటి అండి, ఐ వుడ్ లవ్ టు వాట్ ఆర్ అవర్ ప్రయారిటీస్, బట్ దెన్ ఐ విల్ చేంజ్ ద ఫోకస్ ఆఫ్ దిస్ డిస్కషన్ బికాస్ దిస్ ఇస్ మోర్ G20 అండ్ గ్లోబల్ ఇనిషియేటివ్. క్లుప్తంగా చెప్పాలి అంటే మనం ప్రపంచ స్థాయిలో ఏ విధంగా గ్లోబల్ హెల్త్ ఆర్కిటెక్చర్, గ్లోబల్ రెస్పాన్స్ మెకానిజం ఆన్ హెల్త్ ఎమర్జెన్సీస్ పెట్టుకోవాలి, దాని మీద ఫోకస్ చేస్తున్నాము. అదేవిధంగా ఒక పెద్ద ప్రయత్నం అంటే ఆయుష్మాన్ భారత్ హెల్త్ ఇన్ఫ్రాస్ట్రక్చర్ మిషన్ ద్వారా మనం ఏ విధంగా ఫ్యూచర్ హెల్త్ ఎమర్జెన్సీస్ ఏదైనా వస్తే ఆర్ వి రెడీ. సో దాని కింద 64,000 crores రూపీస్తో ఒక ప్రణాళిక ఫర్ శాంక్షన్ చేయడం జరిగింది ఆల్రెడీ. దీని ద్వారా ప్రతి ఒక ఇన్ఫెక్షన్స్ డిజీజ్ బ్లాక్, అదేవిధంగా ప్రతి జిల్లాలో ల్యాబ్ యాజ్ వెల్ యాజ్ రీసెర్చ్ ఇన్ఫ్రాస్ట్రక్చర్ అక్రాస్ ద కంట్రీ పెరగడానికి ప్రణాళిక నడుస్తూ ఉంటుంది. BSL 3 ల్యాబ్స్ అనుకోవచ్చు, ఇన్స్టిట్యూట్ ఆఫ్ వన్ హెల్త్, వేర్ వన్ హెల్త్ రిలేటెడ్ డిస్కషన్, మనం వన్ హెల్త్ రిలేటెడ్ రీసెర్చ్ కొద్దిగా ప్రమోట్ చేసుకోవచ్చు. యాక్షన్ మనం చేస్తూ ఉన్నాము. అండ్ దెర్ ఇస్ ఎ వెరీ క్లియర్ ఫోకస్ దట్ ఆర్ లెర్నింగ్స్ ఫ్రమ్ కోవిడ్ బేస్డ్ ఆన్ విచ్ హౌ కంట్రీ షుడ్ మేనేజ్ ఎనీ ఫ్యూచర్ హెల్త్ ఎమర్జెన్సీ. ఐఎమ్ ఆల్సో హ్యాపీ టు హైలైట్ టు యూ, I didn't want to put that across in so many, but if you see cases per million and deaths per million globally and India, we faced very tough time. Friends, we really faced very tough time. I remember days when every day used to be a new challenge. But if we see what the world has delivered and what India has delivered, I feel really satisfied to submit that yes, we collectively were able to manage so many lives. So things should be taken into consideration to be better prepared for future.
Mike, please. Please introduce yourself. Yeah.
So this is Aarti Kashyap from Deccan Chronicle. When you cited an example of CoWIN, which can be a digital public good, so how do we really plan the database? Will it be centralized, decentralized? The technical efficiency of such tools, irrespective of which country is proposing the digital goods. Thank you.
Thanks a lot. So if you remember, actually, what we are doing in last condensed it in 1 hour. So obviously I cannot bring all the aspects, but these questions really help across. So what happens is, we are saying, if we as a country have come up with a technology tool which we think can help world. Tied it to a convergence mechanism called Global Initiative on Digital Health. We housed in WHO because it is the UN mandated body on health. are saying similar such initiatives across the globe, any country which is willing to them to world at large, we will give it there. Then we will basically solutions, curate them as per the interoperability standards. Because until you have those technological parameters put in place, a software will not talk to another software. I always use this statement that, you know, whatever we as human beings, whatever communication gap we make ourselves between you and us, we ensure that that communication gap got into cyberspace also. Softwares ki kuda egos vachinayi. Those egos have, ecosystem has to be created. So that is where we will say that this will go to a pool which will make it as per standard and make it available to whole world. When it comes to, see, we all have to be clear, this was a very important point you mentioned, not only data or property in national context. We want data of a country to remain in that country. Common data, neutral data, aggregate data can be shared. You need not tell if Love Agarwal became sick, but you can always tell in your country 20 people became sick. At least the other country can get that data. So if you see, when we were discussing what is, which countries flight restricted, which not to be restricted, these are based on data. So we would like to ensure privacy, data security concerns of a country remains addressed. Global should be only on aggregate databases, and these tools are interoperable. They are made available in the pool, and any country in the world, they want to take advantage of technology. See that list, they pick what they like, they just get that, and this global initiative on digital health can in turn support its implementation in of capacity building of that country, in terms of, you know, creating a framework with. I would just like to give an example. Recently I had a meeting with government of Tanzania. They are planning to use technology for health service delivery. Now, I'm willing to help them and I am working with them. But idea is that these will be one by one. How we have supported world in vaccine mastery. So can we create an institutional framework for that to happen as a practice is what is going to be our major effort.
Anyone else?
So when you are talking about check that Haryana model,
so
5 hours per chance per.
So again, you know, we are coming down to basically what is happening in a particular state. Not only we will check what will happen in Haryana, when we are talking about global discussion, because I committed to, I can always discuss other issues separately, but what is critical is there are defined models of data management across the globe. How do we bring concepts on them together as global community is the biggest challenge, and that is what we are trying to work on.
सर, दो हेल्थ वर्किंग ग्रुप की मीटिंग हो गई है, कितना सफल मानते हैं अब तक के सफल? आधे रास्ता तय कर चुके हैं।
देखिए, दो हेल्थ वर्किंग ग्रुप की मीटिंग में जैसे कि मैंने भी बताया है, एक बहुत मुख्य इशू होता है कि जो प्रायोरिटी एक देश G20 में सामने लाता है, क्या उसमें किसी कंट्री ने या किसी ऑर्गेनाइजेशन का ये गलत है? नहीं, सबने कहा है बहुत इंपॉर्टेंट है। दूसरा, उस प्रायोरिटी के बारे में जब हमने बात की तो क्या ये प्रायोरिटी एग्जीक्यूट करने के लिए क्या क्या प्रिंसिपल्स होने चाहिए, उसमें कोई हमारे बीच में मतभेद कोई नहीं है। तीसरी चीज ये है कि अगर हमारे बीच में मतभेद नहीं है, क्या हम इसको आगे कैसे बढ़ाएं, उस पर चर्चा अब चल रही है। तो अगर आप G20 प्रेसिडेंसीज के मुकाबले कंपेयर करें तो वी फील वेरी कंफर्टेबल एंड सेट। अभी तक हमें बाकी कंट्रीज का सहयोग मिला है। मेरू ए नारंडी
Raptor Nation Media, sir.
हाँ हाँ बताइए।
Yeah.
क्वेश्चन दोबारा बताएं प्लीज।
Sir, technology is implementing in the rural areas or urban areas. Mainly in the rural areas, the people bring with the many diseases.
So,
But they
yeah.
could not be identified the
So
available
let me
medicines.
explain to you.
Yeah.
You know, very interesting thing. Thank you for the question again. A single tool can make an impact. Today, technology is all pervading. You are able to talk from a distance through a microphone. I'm able to hear it, technology. You know, we do video conferences, technology, cell technology. Health also is all technology driven. but there is a big digital divide. Not only urban rural, but also the fact that countries to countries. What we are saying is, how do you bring down this digital divide? Let me give you an example of e-Sanjeevani alone. You know, when we realize that COVID, people cannot come out of their houses, how do they access service? Because hospital infection के chances हैं, बाहर निकलने पे डर है, containment zone बनी है. तो at that time, COVID-19, this e-Sanjeevani platform, आज on an average 4 lakh calls, 12 करोड़ के करीब कॉल्स हम पिछले एक सवा चुके हैं. एक एनजीओ ने झारखंड में उसकी एनालिसिस की हेल्थ में, और उन्होंने पाया कि प्रति कॉल पर कॉल द्वारा ऑन एन एवरेज 21 किलोमीटर ऑफ ट्रैवल टाइम सेव आउट एंड 941 रुपीज ऑफ सेविंग बोथ डायरेक्ट కాస్ట్ తీసుకోగలితే సేవింగ్ ఉంటుంది. 941 multiply by 12 crores. This is the saving which has accrued. It transfers $1.2 billion saving to the country, citizens of this country. 21 kilometer multiply by 12 crore. మనం క్లైమేట్ చేంజ్ గురించి హెల్త్ గురించి మాట్లాడుతున్నామంటే కార్బన్ క్రెడిట్ కూడా అందరూ విని ఉంటారంటే ఎంతవరకు కార్బన్ క్రెడిట్ సేవ్ అయింది. సో పీపుల్ నీడ్ నాట్ ట్రావెల్. సో దిస్ ఈజ్ వన్ టూల్. COVID-19 without data. ఓకే, తెలంగాణలో ఈ పర్టికులర్ కాలనీలో కేసు వచ్చింది, ఇక్కడ మనం రియాక్ట్ కావాలి. బికాజ్ హ్యావ్ టు బి స్ట్రీమ్ లైన్. కేరళలో కేసెస్ పెరుగుతున్నాయి, మహారాష్ట్రలో తగ్గుతున్నాయి. కేరళ రెస్పాన్స్ హ్యాస్ టు బి డిఫరెంట్ ఫ్రమ్ మహారాష్ట్ర. ఆల్ ఇస్ డన్ త్రూ టెక్నాలజీ. సో యూ టాక్ అబౌట్ డిజిటల్ డివైడ్, you talked about urban rural disparity. We believe that effective use of technology can actually bridge that. Today telemedicine, because of our connectivity across the country and particularly even in rural areas, we can quality services which are otherwise available by specialists in Hyderabad can be made in Nizamabad. You can always talk to a doctor sitting in, because he may not probably go to, let's say, Bhadrachalam, where I was sub-collector 24 years earlier. But that expert can give advice in Bhadrachalam. Ante kada? Thank you.
Anyone else? So thank you very much for
group meeting. It's really important to focus on other elements of health, and that is where, opposed to what has been done in earlier other health working group meeting by earlier presidency, government has also conducted series of co-branded events. I would just like to specifically highlight, we had a co-branded event along with G7 presidency, along with United States, WHO, European Union, African Union and African CDC, focusing on if any health emergency happen in future, what type of framework should be available so that medical countermeasures are available to world at large. Similarly, medical event which was organized by government of Telangana was one of our co-branded event. Along with Zero, we had a co-branded event on promotion of digital health or use of technology in health. TB, one of the most major killer for few of the countries. Other event, we had a board meeting of Stop TB as part of one of our co-branded event, along with Stop TB partnerships, and parallelly we are focusing on diagnostics as their availability to world at large. This was again done of pharmaceutical. Another digital health summit we had done along with Confederation of Indian. We focused on a very pertinent topic for global health, which is climate impact on health. And this was an event we did along with Asian Development Bank and United Nations Environment Program during our April 2nd Health Working Group meeting. Digital health is another event which was done with along with one of the international NGO and I talked about Advantage Health. This is again positioning India in terms of advantages India offers globally to the health sector, wherein our people across the world can come to India for treatment, which is medical tourism, as our skilled manpower can be made available to world as our soft power to ensure that health services across the globe can be supported by India. We also have one event on hypertension and diabetes, which was again done along with WHO. We had a global vaccine research collaborative event which is happening today and Hyderabad itself. Along with that, there is a joint health and finance task force side event we are conducting, and this event is done in collaboration with Department of Economic Affairs, where the focus is on identifying best practices in terms of interface of health and finance. We all are aware when it comes to health related action, health working together is a very critical element in terms of ensuring that right services are delivered on time. We are also going to have an event focused on adolescent health, newborn and maternal health department. So this again will be another event conducting this month down the line. And as I submitted earlier, traditional medicine summit, value travel, these two events will be done along with the ministerial meeting. Now, while we are discussing on broad spectrum of these events, we have also identified three very priorities. And I would like you to kindly take note of them because these priorities are aligned with the type of challenges globally we have faced in last few years. The first priority is focused on health emergencies, prevention, preparedness and response. Here we are talking about concept of One Health as well as the concept on antimicrobial resistance. Second of our priority is linked with again health management, wherein we are saying that globally there should be further cooperation in pharmaceutical sector, where the focus should be on ensuring that not only few countries have vaccines available, drugs available, diagnostics available, but they should be made available globally. It is Africa, it is low and middle income countries. Equity in terms of medical countermeasures is what we are trying to focus on to the second priority. The third priority, as I had already mentioned, is focused on how digital health innovations. I talked about telemedicine, I talked about COVID, and let me also highlight it is COVID portal, which is an in-house portal through which we had actually monitored the process across the country since the inception of when the pandemic actually started, be it the testing, be it the trajectory of cases across the country. So how technology can actually aid universal health coverage and how it can enable health services to the last mile is our third major priority. Dear friends, these priorities, what is that we are looking for in terms of deliverables? We all realized, let me highlight that, when vaccination across our country is around 90% plus, still there are countries across the globe where vaccination was not crossing 25, 26, 27, 28%. What are those challenges? So should India as the voice of global south not work towards that? And that is one thing which we are as part of our second priority. So wherein we are saying creation of regional vaccine therapeutics and diagnostics research networks, manufacturing networks, and creation of a global medical countermeasures coordination platform. You must be aware that COVAX was a global facility which was created during COVID-19 to ensure that vaccines are made available to low and middle income countries. Through Indian government supported globally vaccines to be delivered based on the manufacturing process which India has. Can we not create an institutional framework ensuring that if next health emergency happen, we need not create those ad hoc facilities? World is better prepared in terms of an institutional approach to ensure that those vaccines, those drugs and diagnostics are available. Let me come to the first priority again, that while this being a very important component, we also see that when COVID happened, we also saw the fault lines global health architecture. the response, the speed at which the response is a very critical element when it comes to managing a infectious disease. As part of that process, we are saying that while we did suffer, we did manage during COVID-19 pandemic, but if world has to be better prepared, then it should have a global health architecture. It should have a non-fragmented health architecture. It should have a non-siloed global health architecture. And let me explain that. What will happen is if some fund is created in World Bank to support provide funding for managing any health emergency, and something is happening, the technical advisory committee of that fund is different, and similarly the technical advisory committee is different, then the decision making at that point of time, when every second counts, will become difficult. There will be silos in terms of response. So that is being global initiatives on managing any future health emergency integrate among themselves. As part of that, we are talking about doing map the ongoing initiatives in health emergencies prevention, preparedness and response, the complementarities of those responses and avoiding the duplication responses so that we are a fit for purpose globe in terms of managing future health emergencies. Second aspect in terms of the focus on health emergency preparedness, I mentioned that climate change is impacting the health pattern across the globe. Talking about working on the interface of climate change and health and ensure that world understand that what type of zoonotic spillovers may take place, what type of change happen in future because of climate change, and how do we remain better prepared for that. Third, I mentioned about the fact that technology is a great enabler. Telemedicine, COVID platform, managing NCDs through this thing, platform, blood bank. If you want a blood bank, can you go to internet, identify where what that particular blood is available or not, and how can I go there? Small initiative, but collectively they impact the health service delivery. Collectively they ensure that the poor men get the right service at right time. So with that as a process, we that the digital initiative, the technology initiatives across the globe should. Today again we realize that everyone is spending a lot of money on technology, but silos. There is no interoperability, and I am sure you would understand that we launched Bharat Digital Mission with a vision to create an electronic health record for every citizen of this. And with that, repeated diagnostics can be avoided. With that, precision medicine promoted. So to ensure that what we are trying to do in India and it will an impact, particularly in the developing nations, we are talking about creating an initiative on digital health, an institutional framework which will converge the world in terms of ensuring that the digital initiatives and technologies put use across the world. We are also promoting a concept of digital public goods. Why should there be reinvention in terms of identification tools? India, I would like to specifically highlight that we took a policy decision to make digital technologies as made available to free of cost to the world as digital. Anyone can use them. If COVID can be used by certain other countries, they can monitor their vaccination platform easily. We have upgraded COVID to monitor now all vaccines delivered to infant and newborns. It is called now UWIN. So if that tool can be made available to across the globe, then monitoring of vaccination, immunization can be much better and can save many lives. So we are also promoting a concept of digital public goods, which should be made available particularly to low and middle income countries. These are the proposed deliverables on that. Going ahead, we discussed three of our in our first and second health working group meeting. We discussed with all the invited countries. We discussed with all the G20 member states and all the international organizations of the globe working in health on that. I am happy to submit to you that advocacy created by India's G20 presidency in health working group, we have been able to garner in principle agreement to all the proposed priorities, and we create technical papers, those thought processes, those approaches made available governance framework through our health working group meeting to all the countries. And this, we would like to use G20 as a forum to ensure that we are able to build consensus deliverables and we converge in terms of ensuring that the better prepared to manage any future health emergency, not only in terms of decision making, global health architecture, but also to ensure that medicines, diagnostics, and vaccines are available not only to few countries in the world, but globally to global south, as well as also the fact that we would like to ensure through use of technology, all these initiatives can be integrated and technology available globally across the world. We have had around 180 participants participating from 19 remaining G20 member states, including we as in 10 invited countries and 22 international organizations which are working in health. This again, just to submit to you, we'll have a main event. We'll also have a side event which is focused on R&D network on medical countermeasures, which will again be discussing those frameworks. What should be done? What type of network should be created so that globally, across the world, there is promotion of availability of R&D networks that's available. We also is going to have a co-branded event on global vaccine collaborative. I mentioned about the collaboration between health and finance in terms of ensuring we are able to take right decision at the right time will be also focused. This event will be happening in Novotel Hyderabad Convention Center, and as well as we are also going to take our colleagues from these G20 countries to Genome Valley, a pride for us, where you are all aware that who is who of the global sciences. So who is who of the global sciences companies exist in that area. మనకి ఇది ఒక మంచి అవకాశం. మన తెలంగాణలో చేసిన ఈ ప్రభుత్వం చేసిన ఈ ఎఫర్ట్ ద్వారా ఏ విధంగా టుడే 33% ఆఫ్ ద వరల్డ్స్ గ్లోబల్ వ్యాక్సిన్ ప్రొడక్షన్ ఈ జీనోమ్ ఉంది. అది మనం వచ్చిన వారందరికీ చూపించగలుగుతాము. మనకి నాట్ ఓన్లీ వ్యాక్సిన్, మనకి పోలియో, రోటా వైరస్ వ్యాక్సిన్ అన్నీ అక్కడ తయారవుతున్నాయి. దీని ద్వారా మనం డెలిగేట్స్కి, వరల్డ్కి చూపిస్తాము. తెలంగాణ రాష్ట్రం, మన ఇండియా ప్రభుత్వం ద్వారా చేసిన ప్రయత్నంతో ఏ విధంగా మొత్తం ప్రపంచంకి మనం హెల్ప్ చేస్తున్నాము. సో దిస్ విల్ ఆల్సో బి షోకేస్ ఆఫ్ ఆల్ are aware that worldwide India is known as the pharmacy of the world. So this positioning is very critical. We want world to understand where India has reached and how India is going to support globally in terms of making an impact in health. So this again is part of our health working group meeting. This is also an showcase our culture. Kuchipudi fusion dance ankochu, Maheshwar Mardini ankochu, Sufi Qawwali or any other Indo country. We plan to take the delegates to Golconda Fort. We plan to take them to Shilpa Village and also to Falaknuma Palace to show the rich culture. So dear, I would like to specifically highlight, idea is to show that this is a country with rich culture and this is a country which is forward looking. So how does India, with that history to modernity, where that passage of India, the trajectory of India is what I like to showcase and collectively like to work with them in terms of making an impact in health. I would like to in that only specifically highlight that we strongly believe media has a very critical role in building public opinion. There are multiple challenges. COVID-19 has brought the importance of health to the fore, and we would like to take your help in terms of identifying those challenges, in terms of proposing those solutions collectively, not only at national level, but also level. We're also looking through your support, ensuring that priorities in health working group and their proposed deliverables are made available to people. They are distributed to the wider set of audience and consensus is built. Everyone has to. These are not small challenges. These are not